It seemed more like I was having some stomach issues. Butterflies in the stomach, whether it was nerves or just something I may have eaten. Finally, at one point said, I better have this looked at. And I didn't realize it was my heart until a doctor said, wow, your heart's pounding away in there. You've got something called atrial fibrillation, or AFib. It got to a point where it was more like my heart was racing like a runaway train. When you go into AFib at work, you have to address it somehow. There was one time when we were on vacation early on after my diagnosis when I went into an episode. Panic was probably foremost in my mind because, number one, I didn't know where the hospital was. Number two, my wife couldn't drive a standard transmission car, which we had with us. Am I going to be into a situation where I'm going to go into AFib when I'm at a wedding reception? It happened. I was in a hotel in Baltimore. What do I do next? It's the little things like that that can affect you in your life, and that's why you call it a quality of life issue. There's always a thought there that something like this can happen. Each episode was a little bit different. My electrocardiologist informed me that there was a procedure that was available that he was excited about, and he would like to, he thought I was a viable candidate. I was the first one in the area to have the hybrid ablation. It's been 18 plus months since I've had the procedure. I've had no appreciable episodes. So I do a lot of things much the same as I did before 20 some years ago. I'm happy with that. I think my cardiologist is too.